When you have upper limb pain or numbness, red flags may go off. Is this a heart attack? Do I have carpal tunnel? Oh god, am I dying? Yeah, okay, maybe, but I wouldn't say that that is particularly likely. A very common symptom reported in my clinic is arm or hand numbness or weakness, usually with a fair bit of concern. And for whatever reason, this seems to come on most commonly during the night. Personally, whenever I hear this, I'm usually quite calm, as upper limb numbness or weakness is pretty simple to understand when you get the anatomy and potential causes behind it. And that's what we're going to be going through today. Disclaimer, this video talks about the most common sources of upper limb symptoms that I see in my clinic. If you are experiencing upper limb symptoms, go get checked out by a physician or doctor that you trust. Don't rely on a YouTube video to diagnose you. As well, numbness in the body can be attributed to either a vascular, meaning your veins and arteries, or a neurogenic, meaning your nerves, cause. For the purpose of this video, we'll be referring strictly to neurogenic causes. All of the nerves that supply our upper limb originate out of our necks. Collectively, this is referred to as the brachial plexus. Brachial meaning arm and plexus meaning bundle of nerves. While there are a bunch of smaller nerves that come off the brachial plexus, its three primary branches are the radial nerve, the median nerve, and the ulnar nerve. Each of these branches supplies different muscle groups as well as dermatomes, and having knowledge of them helps us to determine which nerves may be involved in any potential numbness complaints. By knowing the distribution of the nerves in our upper limb as well as the location of different dermatomes, it's pretty easy to reason out exactly what structures are involved based off of patient symptoms. For instance, as I mentioned before, a lot of patients will report arm numbness during the nights. The follow-up question I always ask when I hear this is, can you trace it with your finger? Usually when I ask this, the patient is able to do so. They will trace from the inside of their elbow all the way down into their ring and pinky finger. Now, having knowledge of the three primary branches of the brachial plexus, we know that the ulnar nerve runs down the inside of the elbow into the ring and pinky finger. When I proceed to ask this patient what their sleeping position looks like, they'll report that they actually sleep on their arm, much like this. Well, sleeping in that arm up position actually creates ulnar nerve root tension. So much so that it's very, very similar to an orthopedic test we do to test for ulnar nerve involvement. These are referred to the upper limb tension tests, and there's one for each of the primary branches. So the most common cause that I see for that kind of nocturnal numbness of the arm is the patient simply tensioning their ulnar nerve for, I don't know, 6 to 8 hours a night. Now, that's a pretty easy fix. Just modify your sleeping posture. There are some other common causes that I see as well, and some more or less common causes that, well, I obviously don't see as much, but are more serious. Sometimes a patient's arm pain isn't due simply to sleeping position, but rather a genuine nerve entrapment or pinching. As a general rule of thumb, symptoms will show beneath the site of entrapment, but not above it. This helps clinicians rule in and out certain different diagnoses. A good example of this will be carpal tunnel syndrome. The carpal tunnel is a small tunnel that exists within the wrist. Inside of the carpal tunnel is our median nerve, which goes on to innervate muscles of the hand as well as provide some sensory input. Carpal tunnel syndrome occurs when this small area becomes compromised, applying pressure and inflammation to the median nerve, causing some intense degrees of pain. The symptoms will be experienced within the hand, which is beneath the site of entrapment within the carpal tunnel. The same degrees of symptoms will usually not be present above the wrist. Don't get me wrong, you might be a little bit sore and experience some numbness there, but it won't be the same intensity as you would in the hand. This is why it shouldn't be first instinct to treat somebody with symptoms that exist solely within the hand for anything above the wrist. Because the symptoms are only in the hand, it's a pretty strong indicator that the problem is just above that, or the wrist. Again, there are always specific examples that do break this norm, but hey, that's why it's important to always check in with a healthcare professional. Conversely, it wouldn't make much sense to diagnose someone with carpal tunnel syndrome if they were experiencing hand pain, but also pain or weakness or numbness in the forearm and the bicep. The symptoms are beginning above the wrist. Therefore, it's probably not the site of compromise. If your symptoms are throughout your entire arm, it's actually most likely that your problem is beginning within your neck. This should be kind of obvious now, knowing that all of the nerves responsible for our upper limb originally emerged from there. That's where the compromise would start. Oh, but just to drive the previous point here about some exceptions being true, there is an exception to this referred to as thoracic outlet syndrome, where the compromise isn't actually in the neck, but again, go see a doctor. The most textbook diagnosis for upper limb effects coming from the neck would be facet syndrome, where inflammation affects the nerve roots coming out of our intervertebral foramen, or more rarely, cervical disc herniations, which is what happens when the discs between our vertebrae herniate backwards and to the side to press directly into a nerve root. Aside from carpal tunnel, which may present with symptoms on both sides, upper limb numbness or pain usually only presents on one side. If you're experiencing bilateral or two-sided numbness and upper limb pain, alongside some hard neurological signs like ataxia, which is difficulty walking, or, and this is a great word to say, dysdiadochokinesia. Yes, that's a real word. It's the inability to do rapid alternating movements. Then you definitely do not have carpal tunnel syndrome. Presence of hard neurological signs alongside two-sided complaints is an indicator for a potentially more serious pathology. If this is you, it's very important to seek the opinions from as many experts as you can until you land on a solid diagnosis. Possible differentials include a central cervical disc herniation, which is much more serious than a lateral one, central stenosis, which is the narrowing of the spinal canal itself, cervical spondylitic myelopathy, which is where the spinal cord becomes compressed, and possible infection or even cancer. That's all, guys. Please remember that the internet is not a good place to self-diagnose yourself, and not to step on my own toes, but that also includes my YouTube videos. If you're experiencing upper limb complaints and you've been hit with a diagnosis that just doesn't seem to fit the bill for you, seek more opinions. Checking in with a different physician or an evidence-based chiro or a physiotherapist would probably be a good next step for you. Thank you so much for watching, guys. As always, I would greatly appreciate a subscription down below. It'll help me to keep Netflix. You can click here for the previous video and you can click here for the most recent one. Have yourselves great days.